Time for this week's Happier at Home with Deb Marcello. This morning we're talking about important questions for maximum medication benefit. Deb joins us live now. Good morning to you.
Good morning, Matt. How are you?
I'm doing well. Always good to see you. All right, so let's kind of start at the top. As we age, a lot of people may need medication, and that may increase in terms of the amount of meds as we get older. The first question we should be asking is, what is the medicine supposed to do for us, right?
Right. We want to consider how to maximize the use of our medications, but also avoid problems. So, and really knowing your pharmacist or your doctor and talking to them about these things is where to start. So, know your medication, each medication, what they look like, and what the desired effect is. So this way, if you start taking the medication and that desired effect doesn't occur for a little while, you can revisit your doctor and let them know about that as well.
And the doctor and your pharmacist in particular are a great resource, because I know when you go up, they'll often ask you if you have any questions when you're picking up that med, right?
Yes, and make sure you take advantage of that. You want to know if there are any special considerations with your medications. Synthroid, that's the medication you have to take before meals, maybe about a half hour before meals. Some inhalers that are steroid inhalers in particular, if you don't rinse your mouth out after you take them, you could develop an overgrowth of yeast, commonly known as thrush, or even develop some hoarseness. Know if there are certain foods that you should not take with your medications. Grapefruit juice, for example, will either speed up or inhibit the absorption within your body of certain medications. So common medications like statins to lower your cholesterol, antiarrhythmics, blood pressure medications, some antihistamines can have interactions with grapefruit juice. So knowing these things, talking with your pharmacist about that is really important.
Another consideration is side effects and knowing what to look out for, right?
Right. Just knowing if all of a sudden you're starting to feel something, that this may be a common side effect from medications, and talking to your doctor about that side effect as well. You want to know, especially if there are any medications or even herbal supplements, things that your doctor may not know about because you didn't tell him or her about that. Herbal supplements can also interact adversely with your medications. So knowing the interactions between medications is important. And you could talk to your pharmacist about that, but also we'll put on within our blog later on today, if you want to check it out, there are drug interaction checkers where you can put your herbal supplements, your drugs, all your medications in there, and it will check the interactions and make sure that there aren't physically anything interactions that you need to talk to your doctor about.
And I think that's in particular an important note. If they're prescribed medicines, most likely your doctor or pharmacist will probably take note of any medicines that should not be mixed. But if you're taking a supplement that they're not aware of, that's a crucial conversation to have.
It really is, because some people, I think, they load up on supplements and don't really realize that with medication and the way that our medicine has evolved, we started from all herbal supplements. And so they really do have effects on your body, and it can interact adversely with your other prescribed medications, as you said.
Yeah, Deb, always good advice and always good to see you here on Good Day Rochester. Thank you so much.